Obviously, the emotional and medical health of our social capital, our children and their parents, is at stake, and it has been all along. Without sounding too dramatic, I mean, what we've got now is 2 out of 3 kids in America have some exposure to violence. That doesn't mean they're all traumatized. But if you look at the epidemiology, you talk to public health folks, and these are people, conservative people, who aren't waving a flag saying, oh, stop trauma and stop violence. I mean, they care, but we're trying to be measured about this. It's somewhere around $1.6 million a child if we don't intervene. That's the cost of them to society, however you want to measure society, before they die. And they usually die untimely, early, pretty expensive deaths. So just looking at the expense, right, what we might call the utilization dollar, we need to wake up around doing the work, because we have 36 evidence-based treatments now. They all work. Kids get better, adults get better. People that have been traumatized for 35, 40 years get better. But we need to empower with both the resource of time and money at the graduate level, the undergraduate level, supervising level, at all levels of service delivery. We need to be able to have people learn how to do this work and then be allowed to do it. And one of the things that stops people being allowed to do this is the actual agency themselves, because the agencies themselves aren't trauma-informed. So they're hurtful, they're coercive, they're restraining, they're not socially just. And when economic times get hard, whether it's a not-profit or a for-profit, people start squeezing people, and it's, you know, you could say it's human nature, except that we're evolved enough to know that there's another way to be natural and to be human than to coerce and restrain. So at stake is certainly kids' future and so the leadership, future of our leadership. A cost we can barely contain now or afford now is just going to be increased. And, you know, this takes a longer time, but I'll tell you, the more we restrain and seclude, the more that we allow trauma and violence to move into children's lives, the more that the kids, as they grow, will end up feeling isolated, feeling immobilized. And when they feel isolated and immobilized enough, they start to revolt. And they are revolting. Their behaviors look revolting. And the mentalist model out there, and it's not a conspiracy theory, it's just convenient, is if these kids had better character, if their parents raised them right, if these kids worked harder, this trauma and this violence, all this stuff you're talking about wouldn't affect them at all. And that's completely untrue. That's another intense urban myth. So what happens is these kids start to revolt. And I can give you lots of examples, but the giant cost to society is going to be huge fragmentation, huge fragmentation. It's you know, it's by any number of men and women in government and in healing fields and in research fields, any number of prominent, level-headed people will tell you it's perhaps our #1 public health challenge right now.